at the Greater New York Dental Meeting, and I just ran into my buddy Sam Weisz,
Hey.
who I love your Twitter at the most. What is it? Ask My Dentist?
Ask My Dentist.
And you were showing me, you brought me a gift that you started your book, Sugar Bugs.
Yes.
Tell me, well, first tell me the story about you and how did, you're in Chicago.
I'm in Chicago. I practice dentistry, family dentistry with my dad, actually. Grew up in dentistry and started getting passionate about kids and seeing kids. And I always had a story in my head that I'm telling kids as I'm cleaning their teeth. I'm getting all the sugar bugs out. I'm cleaning them all out. And so it morphed into a book. So my wife's an illustrator, author, and she helped a lot.
Wow.
And it's a factually accurate depiction of the mutan family, so strep mutans. The little bugs look just like they do on electron microscopy. And it's a story of Theodore who loves sugar. And he loves sugar so much that all these mutans move in.
And Theodore is a kid?
Or I'm sorry, it's Robbie is the boy's name.
Robbie is the boy's name?
Yeah.
This is Robbie?
Robbie, he eats gummies, donuts, breakfast, lunch, and dinner. So they become fast friends and start moving in, and all of a sudden he starts to realize that these sugar bugs are not his best friends. They move into the house, his teeth start to go rotten, they're playing in the house next door where his baby tooth used to be. Mom's teaching all the sugar bugs about how to be nasty little sugar bugs and wreak havoc in his mouth. So we wanted something that is positive for dentists to go and teach, because most of the books that you see now, it's real negative verbiage. That we don't want the word scary anywhere near, whether you're saying not scary or it's okay. Like, we want all really positive language so that it teaches kids that it's a fun place to be, not a tough place to be.
Now, on your Twitter, you're Ask My Dentist.
Right.
But you have a YouTube channel too, right?
Yeah.
Now, is this in a video on YouTube?
I don't know if we have a video for this, but I actually started a YouTube way back, I did a lot of outreach in dental school and wanted to continue that. So I did, how to try to take care of a toothache at home really quickly before you get to the dentist, stuff like that, to help people get help.
How would you like to get this out of me? I mean, overall, I think at the end of the day, you want to reduce decay.
Yeah,
I mean, that's what
exactly.
every dentist wants to do. So what is your big plan of how to reduce decay with this book? Are you going to...
So the idea is to get it into every hand of every kid, of course, and it's a great primer for dentists to go into schools with, because it's a built-in program. So when we struggle, as you know, we go to schools, we don't know what to do, what should we bring? You just bring the book and you can hit the three main points that I think everyone should hit on, which is diet and sugar and taking care of your teeth, like how to do it, brushing 2 minutes 2 times a day, and then going to see your dentist. So it kind of encompasses everything, and that's how we reduce decay.
How do dentists order these, and how much does it cost?
So they're, retail at Amazon and Barnes and Nobles and that kind of thing are $15, and Shine carries it.
Really?
Yeah.
And what does Shine sell for, and what does Amazon sell for?
I'm not sure what Shine sells it for, but I know Amazon, the retail is $15.
Is there any volume discounts?
There are. You can go through Mrs. Weisz Books is the website, and you can...
Mrs. Weisz Books?
Yeah. And
Where's that on here?
MrsWeiszBooks.com. It'll probably be in the back.
Spell it. That's your name.
Exactly. So
okay, so that's your wife, Mrs. Weisz?
Exactly.
So www.mrs for Miss Weisz, WEISZ books BOOKS.com.
Yeah.
And then your website now, Ask My Dentist
TV.
AskMyDentistTV.com. That's your YouTube channel.
So I made a website built around the YouTube channel. The website is just kind of prime them over if they want to get more information or touch base with me directly, and I can answer questions. I just realized I did a lot of missions to Africa and to other places, and there's so many people in need in our country that are just on the web trying to search for answers, and I wanted to actually try to at least answer as many as I could. So people kind of hit me up on Twitter and say, I got a toothache, and whatever 120 characters, I try to at least give them some guidance.
Yeah. I think the internet's actually killed nationalism. I mean, you put something on the internet, doesn't matter if it's Kansas or Kathmandu. I don't see any boundaries with the internet.
Yeah,
it seems like anything you do for America, you're helping Africa. Anything
Totally.
you do for Africa, you're helping America. I mean, it's all one big. I think also a huge marketing thing for this would be is I know a lot of dentists who did things similar to this where they got them to the OBGYNs and the pediatricians.
It's a great idea.
And I bet you if you put your sticker, your name, my dental office, and my phone number and all this, and went out and gave them, asked your local pediatrician in your zip code, how many new babies are checking in every day. And if it was like 10 a month, which is that's about what the pediatricians I know. And if you were giving them 10 a month and they were saying, hey, here's a gift from your dentist, Dr. Howard Farran up the street. He wanted you to read this, get a jump on this. If you just converted 10%, that'd be $150 would be 10 books. And I think most people, 1-800-DENTIST, you're paying about $100 for a new patient.
Yeah.
Google ads and Facebook ad, most people are paying $150. So 10 of these books would be $150. I bet if you gave a pediatrician or an OBGYN 10 of these a month for how many new babies they were being delivered, that might be
Oh my gosh.
me out.
So what we're doing, that's the marketing platform. I mean, the successful offices, they're using this, and now you're getting word of mouth advertising, not the, coming on a special deal. I give this, there's pediatric offices, they give it to every new patient. But especially like an expectant mom, for us general dentists, they don't know that we see kids, and I give it to them and say, like, here's a book for your kid when they come, or the new patient that has little kids. They're like, oh, you see kids? Oh, that's awesome. New patient like that for $10 instead of $100.
And what Sam just said, I just don't want it to slip over your head, because what he says is very profound, is that, moms make 91% of all appointments, and when they come in with a third-person endorsement and have some element of trust, they're very likely to trust you, accept the treatment plan, whatever. But when they're coming off on Groupon or some coupon or some ad, they're starting to feel overwhelmed. Like, well, I'm making this decision. I'm picking Sam, and I just came because I saw a coupon, and I don't know if what you're telling me is right or true, and they're very nervous. But if her friend Julie says, oh my God, Sam's great, go here. And then she comes in relaxed, listens, buys. But if a pediatrician or an OBGYN or a pharmacist or somebody in healthcare who she probably perceives as smarter than her best friend, Julie, but yeah, I think this would be an incredible marketing thing.
Yeah, they I know a Growing Smiles office that we have, they put it on the cover and give it to all their referring doctors, the pediatricians and it's sitting in their waiting room with their logo on it, automatically referring every single patient that comes in. It's like the easiest thing. Their doctors are referring to them without even knowing.
So your wife's an illustrator, so is she making stuff for your website, your dental office website?
No, I need to get her to do that, right? Yeah. She made my little logo. She didn't give me enough hair in here, but it's in here somewhere.
Well, she was just making you beautiful, buddy.
Yeah, right?
So your dad's a dentist, so how old were you when, I always curious, did he kind of push you to dentistry? Did he kept saying, Sam, look over here?
I was like, I'm never going to be a dentist. No one likes going to the dental office. Keep me away. And he's like, trust me, you're going to be good at it. You'll love it. I was always kind of an artist, so he knew the art and science. And so in high school, he's like, just come work in the office. I was filing papers and helping out with the front desk.
In Chicago? In Chicago.
And then, I just started liking it. Still resisted when I got into college. I knew I was going to be in the sciences in something, a helping profession, and I kept on gravitating back to it.
So what year did you get out of dental
I
school?
graduated in 2006, so I've been out about 10 years now.
About 10 years?
Yeah.
And your dad's been doing it how long?
About 40, maybe.
Now, was he the only one before? Was there?
Yeah, he was
the first one.
Yeah, he's the pioneer.
And so, when you're sitting at home at Thanksgiving around the table, your dad's talking about the good old days, and what does he think about the health of the profession? Does he think it's going in a good direction? Is he concerned? Does he think it went off a cliff?
I don't think he thinks it went off a cliff. I think, he's built a practice and taught me to build a practice based on carrying around patients and not the deals and not that kind of thing. So, in our sense, we live in this bubble that doesn't really exist anymore. For me, coming out, people are not building practices like that anymore. It's, all insurance-based and all that kind of stuff. So I think he's scared about that you just have to see, hygiene patients every half hour and whatever it is, and that's just not how we practice. But if people kind of resisted that, I think.
Well, do you guys take insurance?
We take it as partial payment, yeah, of
Yeah.
course, but we don't. It's not like their primary.
It doesn't dictate.
Yeah. What
Yeah.
kind of treat? We try not to let it. It always does, but we try not to let it dictate how we want to treat people.
So how old are you and how old's your dad?
So I'm 35. My dad's 64-ish.
And do you guys do the same procedures, or does he do
We have a
endo
little bit of a
and you do
mix.
implant? Or tell us about your mix between the
so
generations.
he did a residency at a VA in California, the VA in Los Angeles, and they were really perio heavy. So out of I think the 5 residents, 4 of them are periodontist and him.
Oh yeah.
So he does a lot of grafting and a lot of the perio stuff. And I went to Long Beach because I wanted to learn about implants. So I did my VA residency in Long Beach.
In Long Beach.
And they had an awesome implant program that we rotated through.
Sorry, I have to ask, but is it hard to go back from the warm weather of Long Beach to Chicago with those winds blowing off? What is it, Lake Chicago or what's
Chicago? Oh, Lake Michigan.
Lake Michigan.
Oh yeah,
those winds
awful.
can be pretty cold.
It snowed a foot before Thanksgiving.
Really?
Yeah, and so yeah.
So you ever get the urge to go back to your VA and start?
Some were warm. I'd probably visit you in Arizona. I think it would be my favorite. But yeah, family drew you back to the Midwest.
So your dad's doing a lot of perio, and you're doing implants?
Yeah, implants, and I got into Invisalign, and so I.
Now, are you surgically placing implants?
Yeah.
And so, what would you tell a young viewer here who's never placed a young implant? How would you start that journey? Would you?
I think coursework is key, just so that you get the comfort level. I mean, I don't want to ever do anything until I'm kind of proficient at it. So I think, I've heard of tons of these mini residencies and things where you're placing lots.
But you did a residency right after dental school?
Yeah.
So you walked out of dental school and straight into California's. Tell them about
program.
that.
Okay, yeah. So
how did you find
me,
that program?
I was researching certain programs that I knew they were going to be placing implants and learning about surgeries and rotating with oral surgeons so that I could feel like an oral surgeon when I got out. I mean, even though it's hard to do that in 3 months, but at least get my feet wet. And
it was only a 3-month program?
Well, it was a year program, but you rotate. So they had a endo residency there, so you get to literally be with the endo residents for 3 months, and then you're with the oral surgeons. You are the oral surgeon for 3 months, and then you do restorative and pros and all that. So it's a great mix for me because I was learning the pros part of the implants while I'm placing them. So I feel like that gives you a leg up in knowing.
And how did you find that residency? I mean, was there a website that listed all the residencies?
I don't know. I guess everyone does word of mouth. Yeah, like everyone kind of starts hearing this one does this one's good at that. And I had kind of a list of about 4 or 5 of them that back when I was going, I think it was like Denver was one of the ones that I knew you did a lot of surgery at. Long Beach, I know San Antonio is a big one for that kind of thing, and that's what I was looking for.
Yeah. Now, did you pick one system when you got out of school, or do you use multiple systems?
So we trained on Straumann in school, and then the surgeon that I refer to now uses BioHorizon, so I switched over to BioHorizon, so we're kind of all compatible. For me, I just felt like having something that was like a name brand as a general dentist, I don't know, it's just that crux that I have that I wanted to use something name brand. But I also love Blue Sky Bio's stuff, and they're based out of Chicago.
So I want to ask you some of the controversial questions. The biggest one is to surgical guide or not surgical guide.
Yeah.
Where do you weigh in on that?
I've started to move to mostly surgical guides.
Really?
Again, like as a general
what
dentist,
are your thoughts on that?
I just think it makes it so easy. Like, I mean, you put this thing on. I went to a lecture on Salama, and he was talking about how
Salama,
Morris Salama, one of the like a periodontist.
It was he with Goldstein and Garber in Atlanta?
Yeah, exactly. Yeah.
Now, how do you say his name? Maurice, I thought.
Maurice Salama. Yeah,
and he's the founder of Dental XP.
Right.
Yeah, I've been trying to get him on a podcast.
Yeah, so I went to his lecture, and he was talking about his son, like watching a surgery. Who I don't know how old he was, 10 or something, and he did it with a guide, and he's like, I could have done that, Dad, and it's true. I mean, you don't lose sleep at night with a guide. You put it on, and everything's there for you. So I don't know. I think it's the way to go. They're expensive though.
And go through how you make a guide. Do you take
so
it?
I haven't. That's where Blue Sky Bio comes in. I think you've had a guy on with that course, and I'm still learning how to make them on my own. But right now, I take the impression. We get a CT, and I don't have a scanner. I send it to my surgeon. He takes a CT.
A CBCT?
Yeah.
Okay.
And then I take the impressions and send it to a lab, and they marry the two. You don't need any special like barium sulfates or anything like that. You just take an impression and have the CT, and they marry it, and then you start planning the guide on the software where you want the implants, and then the guide gets fabricated. And
so a lab makes the guide.
Lab makes the guide.
What lab are you using for that?
Functional Aesthetics in Missouri is the one that's making them for us now.
FunctionalAesthetics.com?
Yeah, I don't know exactly their website, but they're in Farmington, Missouri. And
that's outside of St. Louis.
Yeah.
Isn't that where they're having all the riots or?
Oh, I don't know. Maybe.
Farmington.
I hope they're still.
Okay, so
it's Functional Aesthetics Dental, out in Farmington, and so they worked with BioHorizons, the one that.
See if you can find it, right? Functional Aesthetics.
Yeah, BioHorizon, my rep kind of.
Well, if you go to BioHorizon, don't they have a list of labs?
I don't know if they do or not. Yeah, and I know that. Again, Blue Sky Bio does a good job of saying like these people will make guides for you, and so I know they do that.
So you didn't buy a CBCT, you used your oral surgeons.
Yeah.
Was that the lab?
Well, that's BioHorizon, so that's.
Oh, that was BioHorizon. Oh, yeah. Well. No, we were looking for that lab he was talking about. So you using your oral surgeon CBCT, so you didn't have to buy one.
Right.
So that's pretty.
Because I don't
do
savvy. Enough cases to justify making that kind of purchase.
And I also believe, how old is your cell phone? Like, where's your cell phone right now?
Yeah.
And how old's your cell phone?
Yeah, like a year and a half, probably.
And are we going to want this in 10 years?
Right.
And a lot of those oral surgeons and people are telling me that they bought the CBCT, and then after 5 years, they don't want it anymore.
Oh, he's already on his second. I know that.
Yeah. So if you're going to have to do a lot of CBCTs, because just like your iPhone, you're gonna change out your CBCT as often as your iPhone.
Right, and then I have the coverage from him. I'm not too proud to say like this is a case that I want you to do. This is a case that I'm comfortable doing. So we have a good symbiotic relationship that way, and he takes the scans, and then he gets at least an eye on the patient when it comes back to them, if it does.
So let's switch subjects to endo. You said your residency did 3 months with endo.
Yeah.
Are you still doing endo?
Yeah, I love endo.
And what's hot and what's not in endo?
Oh gosh, for me, I use a Brasler system. I just love that they have
out of Savannah, Georgia.
Yeah.
So what's their Brasler system?
Their cones fit their and I'm sure they all do now. But their cones fit their last file, and then
the gutta-percha cone,
right,
is shaped with the same taper as their file,
and now
which is very nice.
Yeah, and now their sealer is actually merges with their gutta-percha because it's lined with something. The science. I mean, you're catching me off guard with the science here.
Yeah,
But the sealer merges with that, and it's all kind of one bonded system now. And so I don't know. I just like that system.
So what % of your endo are you doing, would you say?
70 maybe.
70. So
yeah.
what do you like to keep, and what do you like to refer?
I like to keep the easier stuff and refer the harder. So second molars I typically send out.
Upper and lower.
Yeah, depending, if it's a big guy and I can access it, and then I'll do it. If I can see the canals, I'll do it. If they're curved, I send it out. If they're fine and I feel like they'll need a microscope or whatever it is, then I'll send it out if it's going to be a tough access. But other than that, I like doing everything. I like being a general dentist.
Yeah, and with this book, is it safe to say that you kind of like doing pedo too?
I love pedo, yeah.
You love pedo?
Yeah, so that's my...
And that's not very common.
I know. And my dad loves it, and so does our other partner.
Your dad loves pedo?
No, he loves that I do it.
Oh, okay, your dad loves pedo, yeah.
He's like, here, have all the kids.
I don't get it because I raised 4 boys, and that's one of my boys.
Yeah,
and my 4 boys were the greatest thing that ever happened to me. But even when they were 1, 2, 3, and 4, I still couldn't transfer that in the office and want to see a 1, 2, 3, 4-year-old. I mean,
so my
don't know
two
why
best
that
friends
is.
from dental school were pediatric dentists, and so I actually spent time shadowing them because I didn't get it, like how to manage these kids. And then once I understood what they're doing, it just made a lot more sense.
And another shift of pediatric dentists, back to this book,
Oh yeah.
is that every time I meet a pediatric dentist with $1 million practice, they were not interested in referrals from general dentists waiting till you had a child that was upset and didn't cooperate and has already had a bad experience. They went straight to the pediatricians. They want the kid to come in with a first positive experience. You know, they want this child first time at AIDS.
Yeah.
Their rule is generally they want to see it when your first within 6 months of your first tooth appearing or your first birthday.
Yeah.
And they want to build their practice seeing that fresh virgin kid at 1, not wait until he's 4 and then you couldn't do a pulpotomy and a chrome steel crown and he's been traumatized. And so back to this book. I mean if you are if you like children, and what I like most about the children is that they have moms attached to them with husbands and grandmas and grandpas. I mean it's kind of like I do the children to get all the
in a way
adults.
the children are like the lost leader to get the that's kind of how we are, is
and it's especially tough in Arizona because 25% of my practice speaks Spanish as a primary language. I mean I'm right across the street from the Guadalupe Indian Reservation, and there's nothing more traumatizing than having like a 3-year-old girl who doesn't speak English and you're trying to work on her and she's so adorable and I don't know how to talk to her. But that's why in my office, half my staff speaks Spanish.
Oh, that's amazing.
2 of my 4 assistants and 2 of my 4
and the assistants are key to pedo, I feel like. When they're trained, I mean, there's something about comforting nature of, our assistants that are women that they just get it. And so they get them comfortable, and then I kind of can just come in and do the exam, and they've already done everything almost.
So is there anything else you want to, any other subjects I didn't talk about that you want to share?
Yeah, I mean, I think it was great. The book is, I mean, the pediatric dentists are buying the book like crazy to give out in their office and to use as a marketing tool. And I think dentists...
Have you posted on Dentaltown?
No.
You should start a thread. Dentaltown,
Okay.
The Pediatric Dentistry Forum, there's 53 forums. And I think the most is endo, then implants. But I think pediatric dentistry is like 4th or 5th.
Really?
And you should start a thread. Just go so that it doesn't sound commercial.
Yeah.
Just sit there and say Howard made me do this. And in fact, we just take a picture and post that on the thread.
Okay.
And say, hey, I just did a podcast with Howard, but Howard wanted me to tell you all about the book and everything. And I think that'd be
awesome.
great marketing.
Thank you.
But I tell your dad that he raised a wonderful son.
I appreciate it.
And,
are you have any that are in dentistry or going?
I have 4 boys, and I don't know.
How old? What age groups?
They're 20, 22, 24, 26. The oldest one's married.
Okay.
And he's putting up cell phone towers, and he's my favorite son because he made me a 3-year-old granddaughter.
Ah, yes.
And a granddaughter is your reward for not killing all 4 of your children.
That's kind of what I hear.
So do you have any children?
I have a 2-year-old daughter. So
and is dad enjoying her?
Oh yeah.
Yeah. There's nothing greater than a granddaughter. So you did your dad right by giving him a 2-year-old.
Yeah. Thank you.
But hey, on that note, start that thread. Did Cammie take a picture, or she'll text you the picture?
Well,
start the thread, and
for sure.
Good luck on your book because
thank you.
There's 9 specialties, and everyone always wants to talk about pediatric dentistry or endodontics or all this stuff. But I think the most sacred specialty is public health dentistry, and this goes under public health. We don't want to. No fireman wants to go put out a huge fire. Every fireman wants to go do checks on buildings, make sure the sprinklers are working, and we all want to prevent disease. We certainly don't want a 5-alarm fire. And when I see a kid with baby bottle tooth decay, when I see these parents that come in, and right now there's a lot of confusion because the marketing is that this is a healthy snack, this is a healthy sports drink, and they think they're doing the right thing, and their kid's got 10 cavities.
Yeah.
So congratulations, I consider this a public health dentistry.
Thank you. That's what I'm going for.
Yeah. All right, buddy. Thanks for
you.
coming by the booth.
I appreciate it.